Hello and welcome, it's Chris from Christopher Hall Training, and welcome to this tutorial where we're going to be looking at cycling fitness and the biomechanics of efficient pedalling. Now I'm going to be focusing on one aspect of it, but it is quite a fundamental part of the pedal stroke, and we're going to build some pieces. So we're going to look at some anatomy, and then we're slowly going to sort of build into a let's just say a slightly more functional look at the pedal stroke. So we're just going to look at a little bit more pure anatomy first, then we're going to focus on the functional part of the actual pedal stroke. Before we get into that, please do come along to Twitter, Facebook, Instagram or YouTube. You can see them up there in the top right hand corner of the screen. So please do come along, like and follow. Wherever you're watching this video, please do pop some comments below, any feedback, any comments, any questions that you may have. It's great to have any questions. I can then clarify some, maybe some bits that I missed out, or clarify some understanding if you do have a question about anything that I'm talking about. So what we'll do now is we'll get stuck in to the anatomy. The area of the body that we're going to be focusing on is the hip. Now, it's a very important part of the body when cycling because it determines what the knee's going to do, because your foot is fixed on the pedal and the only margin for error is at the knee. Now, the hip is where in some respects is what dictates where the knee goes, so that's what we're going to be focusing on. Now, the two main movements of the hip during cycling is hip flexion and hip extension. So just draw a very simple picture of someone stood, and then you've got the spine there. Hip flexion is when the knee goes into this sort of position. So that is flexion. So this angle here, obviously there is 180, and then when it comes to here it's dropped down to 90, so the hip has flexed. Then we've got the second one, which is hip extension. Now granted, the hip doesn't go into a full extension during the pedal stroke, nor does it go into a full knee extension during the pedal stroke, but it goes from this flexion position into an extension of the hip. So extension, so a very sort of pure look at extension is where essentially the foot comes back into that position. So it's coming back from 90 back to 180, and then if you wanted to, you could then take it where the leg comes sort of in behind like that. So from a running perspective, it's a lot easier to understand because you've got the hip flexion here as the sort of stride comes through, and then you've got the where the impact happens, and then it goes into a hip extension. So from a very basic perspective, the cycling pedaling motion is hip flexion, hip extension, hip flexion, hip extension. Obviously, there is knee and there is ankle as well, but as we are focusing on the hip, this is just the bit that I'm going to be talking about. Now, what's important is most people will end their understanding of hip mechanics at flexion and extension. But there are two other aspects of what the hip needs to do in flexion and extension. And that comes down to external rotation and internal rotation. Now, again, these aren't massive amounts of rotation, but they need to be there. So with hip flexion, we also need external rotation. So as the hip comes into this flexed position up here, it also needs to go into an external rotation. So if we look straight down, so this is a bird's eye view of the pelvis, what you've got is not only is it flexed, but also it's slightly externally rotated. So this would be sort of in a straight line, for example, and then you would come down off the knee, and then you would come to the foot onto the pedal. So the knee is slightly out when it comes to the top of the movement. And then when it comes to internal rotation, it's the opposite. So as the pedal stroke is pushed down, the knee comes back in. So there needs to be not only hip flexion and hip extension, but we need to have the ability for the hip to externally rotate and internally rotate. Now, what happens is a lot of cyclists, maybe cyclist coaches, they solely focus on hip flexion, hip extension, and it goes no further. But to have a healthy hip, you need this external and internal rotation. And what we're going to do over the next couple of slides is talk more about why we need this. What are the compensations that are happening which is going to affect the efficiency of the pedal stroke? So what we'll do now is we'll get stuck into talking a little bit more about external and internal rotation. At the most basic level, when we're looking at hip external rotation and internal rotation, these are the degrees by which we would want to have at the hip. So these are sort of normal, healthy ranges. Having more wouldn't be the end of the world, but certainly having less than this could start to cause problems. So these ranges are taken. So that, again, this is not necessarily a functional cycling test. This is just a very basic hip internal and external rotation test. You would also go with, so what I'm going to describe now is where there is no, in some respects, load going through the hip. So what we generally do is we get people, they will be sat on a stool or on a bench or on a couch, like a massage couch. And what they will do is they will simply just have their legs hanging down here. So if I just put one leg, two leg with the feet at the bottom. Now, if we are looking at external rotation, we ask them to move their foot as far as they can in that direction. So the foot will come up into this position, and then we would take some sort of reading. Then we would ask them to place it back down, and then for external rotation, we would ask them to go the other way. So their knee is at 90 degrees, their hip is at 90 degrees, and we're just asking them to go into an internal rotation, which is up, out to the side, and then an external rotation, which is again the other way. So it sort of comes across the body. So that's just a very basic test. There are more tests that I would recommend doing for cyclists: being stood up, getting them to flex at the hip, getting them to squat down, getting them to do it on single leg, getting them to balance, all these types of things, because it's painting a picture. And that's what we want. This is just one tool that would be used at the very sort of, I guess, beginning of some sort of hip assessment of a cyclist. So what we are looking for is these types of normal ranges with regards to degrees. So external rotation would be 45 to 55 degrees, and hip internal rotation would be 35 to 45 degrees. So that would be something that we would be able to tick that box if we saw it. Then we would go and do other things, and then we would start to paint a picture of what is their hip actually like. Now, with regards to this tutorial, and as far as I can take this, that's all I'm going to explain with regards to the mechanics of the hip. But what can happen if we don't have these ranges? So again, it's not just these ranges. There might be some other things, but these are a valuable piece to the puzzle. Now, essentially, what we're going to get is we're going to get compensations occurring. So at the joint level, now obviously this does involve the muscles as well, but with regards to how joints line themselves up, what we might see is overpronating feet, a valgus knee, and toes out. So what that basically means is if you look at someone's feet, so we've got the the calf muscle, then you've got going under the heel, and then you've got the arch. What you would basically have is that collapsed, so you wouldn't have that space. So that's the medial arch of the foot. You basically wouldn't have that, so that foot is overpronating and it's collapsing. So again, if I sort of draw that, it comes down off the heel, and then essentially it will probably be flat all the way through. But what we do want is we want a good sort of healthy arch. So there is a space where you can, place something under there. Valgus knee. Now a valgus knee is, so if I draw a very simple picture of a pelvis, and then what will happen is the knee will kind of come in like that. So if we're looking at a cyclist, so if I just draw, we've got the back wheel there, we've then got one pedal at the bottom, one pedal at the top. Now, what we would generally see is the knee collapsing in like that as they push down. So it's not, so if I sort of draw wheel, pedal, pedal, what we want is a straight up and down, straight sort of vertical up and down. Now, as it's moving, what's going to happen, as we get to the top of the pedal stroke, it's going to slightly bow outwards. And then as we get to the bottom of the pedal stroke, it's just basically going to bow back inwards. So that's where we get the external rotation as we get to the top, and then we get the internal rotation as we sort of get to the bottom. But essentially the internal rotation is bringing us back to the center. So with regards to what we're looking at from the joint level, that's the type of thing. So if I'm following a cyclist and I can see they get to, or even throughout the whole of the pedal stroke, they've got a sort of knocked knee type position, so their knees collapsing inwards, I know that's an inefficient pedal stroke in itself. So just by simply bringing the knee back out into the center, that's going to be a more efficient. If we can then get a little bit extra external rotation, internal rotation, so we've kind of got that sort of inward-outward movement of the knee, then that's going to be a little bit more effective in itself. Because what this is doing, so the joint level, this is the kind of thing that we might be seeing. Oh, and toes out. If you're looking down at the pedals, now again, we are clipped in on for the most part, but what you might see are sort of feet pointing outwards. So that's me looking down at the feet. So there's the ankle joint. These are the toes out here. So they're pointing outwards. Again, what we're looking for is some degree of a parallel nature to the feet. Now there is value in having a slightly up to 15 degrees sort of toes out, but essentially we're looking for that sort of parallel position of the feet. So what then happens at the muscle level is we get the gluteal muscles, they become inactive or less active, and then they put strain on the hamstrings and the lower back. So if we've got this sort of knee bowing inwards type position, that basically tells us that the glutes aren't working that effectively. And for an efficient pedal stroke, it's very useful to have more active glutes. So when you look at scientific studies about the biomechanics of cycling or muscle EEGs when we're coming to cycling, this is one of the variables that can affect it, is the fact that the biomechanics need to be how it needs to be. So we need to have this position of the knee, because if we don't have the position of the knee and the hips aren't working as properly as they can, we're then going to get skewed muscle EEG readings because the glutes are inactive, the hamstrings are overactive, obviously the quads are active, and the lower back is going to be active as well. If we were to have a more proper position and better biomechanics of the hip, knee down to the ankle, then what we would see is slightly more active glutes, slightly less active hamstrings. Obviously, the quads may be as active, but we will just get a better reading. So what we then get, if we're getting these compensations, we then get what are called energy leaks, and then this puts strain on certain joints. So what we're going to do on the next slide is we're going to look at some of the typical problems that can occur when we have these mechanical or biomechanical deficiencies when we are cycling. The basic question we're asking here is, where can compensations lead? Now, we've got a quote here. Now, this is about excessive pronation. So this is excessive pronation of the feet and how it leads to ACL injury. So what we need to be able to do now, obviously, as I've mentioned before, excessive pronation is a symptom of a hip that's not internally rotating enough, or not sort of, let's just say, moving correctly, if you want to put a broad term on it. So this, again, this is where it can lead. It doesn't have to lead in this direction, but what we're essentially saying is that if we start getting these, and if we come to this, because it kind of explains it down here, when muscles fail to function well, it places unnatural stress on joints. The unnatural stresses cause microtrauma and wear, and the resulting stiff joints give poor feedback and create a greater demand on the muscular system. Damaged joints can lead to muscle inhibition, muscle guarding, and muscle imbalances. So what we get is a kind of self-fulfilling prophecy. So if we have bad mechanics, that can lead to unnecessary stress, which can lead to wear and tear, which can lead to injury, and then we start getting poor biomechanics because we've got muscles failing to function well. We get microtraumas. Now, microtraumas are important to understand because you're potentially doing 60 to 80 revolutions per minute. So that's 60 to 80 cycles through the hip and through the knee. Now, a microtrauma is a small injury that goes unnoticed. So at the time of you doing your bike ride, you won't notice the problem. But the more and more you do it, for the days, the weeks, the months and the years, will then start to cause the problems, which will be muscle inhibition. So muscles not functioning properly. You will then get muscle guarding, which is tightness around damaged areas. And then you get the muscle imbalances from what I was talking about before. When the glutes become inactive, the hamstrings become overactive. If glute medius isn't working correctly, adductors will start to work a little bit more actively. So you start to then get out of balance, and then you get the poor mechanics, which puts unnecessary stress, which puts wear and tear, which causes injury. That further aggravates the biomechanics, which then goes further to unnecessary stress, so on and so forth. So when I see people and they've been cycling for a very long time, they may be sort of 40, 50-year-olds, and they're constantly having problems with injuries, it's generally because of these microtraumas that are caused by bad mechanics. If we could sort the bad mechanics out, yes, there's going to be tissue problems with the ligaments, the tendons, the muscles, so we need to sort those out. Then we need to sort the biomechanics out, because that's where it lies, because that's what creates the wear and tear. So if we can sort the biomechanics out, we then become in a much better place to not have the muscle inhibition, to not have the muscle guarding, and to rebalance the muscles. So it's a very long way round of saying we need to have proper biomechanics when we're on a bike. We need to have proper internal and external rotation of the hip, not only when we're on a bike, but just to be healthy out in everyday life. We need to be stretching. We need to be keeping proper function to the quads, to the hamstrings, to the glutes throughout the pedal stroke and everyday life, because it's those muscle imbalances that are going to cause the problems. And if it then starts to go out into everyday life, that again is going to affect biomechanics on a whole nother level. So in some respects, kind of what I'm saying is this could go on, and I could expand on what I'm saying with regards to how the hip becomes affected. But again, that kind of rides through all my cycling fitness videos. Many cyclists focus on the quads, focus on the knee joint, got to get strong there. But what they tend to neglect is the hip, which is dictating where the knee needs to go, which is then dictating what muscles need to be working, which is then dictating the power output and the risk of injury that cyclist is at. So if there's one thing that you can take from this, is start to put a little bit more emphasis on the hip joint and making sure that that hip joint functions adequately, not only on the bike, but in everyday life, because everyday life is the health setting, which is the foundation to fitness. So again, I could go on, and I'm going to sort of stop myself from talking, so I'm going to finish the tutorial here, but hopefully it's given you a better understanding of the biomechanics. Hopefully it's giving you a better understanding of how you can increase a little bit more of your efficiency on the bike by positioning the knee in the right position, which again is dictated by the hip, by giving yourself hip internal rotation and external rotation as you go through the pedaling stroke. So many thanks for watching. My name is Chris. I will speak to you in the next tutorial.